Work for my meal. Good afternoon, good morning. Jonathan Moore presenting on erectile dysfunction. In this presentation, I'll be discussing the description of erectile dysfunction, the risk factors, both from a Western perspective, the populations affected, correlations between TCM, complementary alternative medicine treatments, and some other things as well. Getting straight into it, erectile dysfunction is described as the inability to achieve, sustain, or maintain an erection for sexual intercourse. This does not include impotence which is related to fertility, or rather the quality and quantity of sperm. Diagnoses are based on previous medical history, which may identify problems with sexual desire, erection, ejaculation, or orgasms, and use of certain prescription legal and illegal drugs. Physical examinations, such as a nocturnal test, where they ask the patient, they ask the man to come in. He stays overnight, and what they do is they observe him whether or not his body will have an erection in the morning when he awakes. This is usually a sign of good cardiovascular health. In which case is why I chose to discuss erectile dysfunction, because for men, this is one easy way that we can use a part of our anatomy to determine our general health. All right. Laboratory examination, lab results, and psychological examinations are also performed as ways of diagnosing. In regards to the psychological test, this is usually performed on the partner of that male. It has nothing to do per se with the actual individual psychology, but that's also an important factor in it as well. Causations are, for one, physical, affecting the central nervous system, in which case the brain is where it all starts. Sexual activity is something that we start with in our minds. It starts in the brain. We have the idea, or start going through the mentality of having intercourse, which then travels down the spinal cord, then makes its way to the pubic region and creating an erection. So if there's a break in that line of communication where the signal is not traveling from the brain through the spinal cord or through the peripheral nervous system into the pubic region, then the erection will not happen. Muscular, in which case it could still be related to the central nervous system, but there could also be physical trauma that a man has incurred. Case in point, how many women in here have actually kicked a boy in the nuts when they were young? This is not something that's not uncommon. It happens, and but like these type of things we laugh at, but these type of physical traumas eventually can lead to progressively worse things. Excessive sexual activity, in which case, you're tired and you're weighing out. There's just no energy for it. Other causations for it are disease commonly associated with diabetes, hypertension, nerve, multiple sclerosis, atherosclerosis, and heart disease, and sexual dysfunctions, which is not often talked about in regards to erectile dysfunction. We usually just associate some type of sexual dysfunction with just the disease. We move past it, we treat the disease, get rid of the bacteria, get rid of the virus, move on. Or we, treat the immune system. But these type of things are also showing what's going on with the system. Once again, we see that diabetes affects the cardiovascular system. Hypertension affects the cardiovascular system. The nervous system also affects the cardiovascular system, because once again, if the signal's not moving, poor action of the heart or the cardiovascular system as a whole. Atherosclerosis, hardening of the arteries or venules, in which case that accumulation of plaque and whatever else may just be preventing a good quality of blood to make it through the system and do what it's supposed to. Side effects of drugs such as cigarettes and alcohol, which cigarettes is also a secondhand thing. Most people don't know that 2 hours after a person smokes a cigarette, the toxins are still inside the person's lungs within the plasma membrane. And so after they finish their cigarette, they come back indoors, although they may not be expelling any actual visible smoke, the carbon dioxide along with various other carcinogens that have time to breathe and interact within the lungs start to develop, and then they're expelled in expiration, in which case other people ingest those things through respiration. Alcohol is also something else that's also just looked at as just the most serious causes or sources of alcohol. We don't bother to think about our sugar as a form of alcohol either. You know, when alcohol is just nothing more than a fermented sugar. So if we this is something that we as adults choose not to have, you know, then we should also make sure that our children are not having alcohol in the form of their cereals or whatever the case is. Injury, obesity, sedentary lifestyle, medications, and this is an important thing because obesity is nothing more than just an accumulation of fat. If the fat is present, then that means that certain functions are going to be impeded, such as circulation. Blood can't travel through. You're also insulating, so you're keeping your system cold instead of allowing it to be hot. Sedentary, if you don't use it, you lose it. Plain and simple. If you're not active with your body, and this is nothing more than another part of the male anatomy that also needs a certain level of activity, then this could also lead to certain, you know, decreased ability and function. As the age for these conditions of these incidents decreases and affects the younger generation, mostly diabetes, hypertension, atherosclerosis, and cardiovascular diseases, as well as certain congenital sexual passed on issues, then it can be likely assumed that this condition will potentially become more common. So we're not going to be just seeing it in a certain population of older men. We're going to slowly start to begin to see this occurring within the younger population. Typically affecting men between the ages of 40 to 75 years of age, with the greatest populations affected being men 70 years or more. I'm not going to go back to that. Treatment for it is usually non-invasive and should include a lifestyle change through reduction and the gradual elimination of excessive smoking, alcohol consumption, and implementing weight loss regimens, increased physical activity, psychotherapy, oral medications, frowny face, surgery, also frowny face, because this is when we're thinking about taking pills, a lot of the times some of the most recent medications, Viagra, and just to name the most prominent, you know, they're creating other liver-related issues. And as we know, if the liver, from a TCM perspective, if the liver's function is impeded, then that means that the quality of blood, which is what a man is actually storing in his liver, where a woman would be storing her menstrual blood, a man stores his erectile blood within his liver. So if the liver is impeded, then the erection is also going to be impeded as well. It's not going to be quality. But we'll get more into the TCM in a second. And these surgeries are also very dangerous things because they're putting pumps. You know, like we're becoming more mechanical in nature than we are biological. And this is to me, this is actually a disgusting thing. You know, to have a small piece of machinery put into you know, surgically implanted into the penis to aid with the pumping of the membranous tissue. This is dangerous because we don't know how that metal is going to affect the system in the long run. All right. Populations affected. The greatest population of people of males affected are 75 years of age. Between the second category is between the ages of 35 and 39. But in this category, this actual category does not fit onto this slide because this category of men is not experiencing erectile dysfunction. However, they are experiencing, this age group is the highest percentage of receiving tumors and sexual transmitted diseases. So this creates another issue because once they get out of this range, then we begin to see them enter the 50-year-old range, in which case 44% of men experience erectile dysfunction, in which case a study done by the National Institute for Diabetes and Cancer, Kidney-Related Diseases has said that 30 million men in 2009 were affected with erectile dysfunction. All right, so after they get out of this age group, they jump into this. And currently, or at least in 2009, this age group of 60-year-old men, we also know what this group of men were doing in their heyday, which was around the time of the 60s, which means a large amount of drugs, a lot of alcohol consumption, a lot of excessive sexual activity, which was sporadic and careless. There was no consciousness to what was going on here. But we'll touch on that in a second. Moving on. From the TCM perspective, we addressed erectile dysfunction as kidney-yang deficiency, mostly with the effects. The issues that we notice are cold sensations in the lower back, weak legs, tiredness, infertility in women, because this is not just a condition that only affects men. A woman's clitoris is actually composed of the same muscle and fiber as the penis. It's just that as the male progresses in his development as a zygote, the clitoris elongates and just becomes the penis, whereas the clitoris just maintains the same size. But in women, erectile dysfunction, it manifests as dryness or inability for moisture or lack of libido. So this is also kidney yang deficiency for women. In which case the points for the treatment for this is warm and tonified kidney yang. The pulse, the tongue is pale and wet. Pulse is deep and weak. Points: bladder 23, dew 4, ren 4, ren 6, kidney 3, kidney 7, bladder 52. Jianggang, which is 3 twin lateral to second lumbar vertebrae. And this is an important point in what I found within the Chinese acupuncture Matsubushi book to be very good in the treatment of impotence and in erectile dysfunction. We have to understand that the Wang Di Nei Ching, the question and answer book between the emperor and Chibo, his chief physician at the time, was mostly about increasing his longevity. Longevity not just meaning his life, but his ability to enjoy life in all of its facets. This man had over 100 kids. The emperor had over 100 kids. So the book of the Wang Di Nei Ching is more about maintaining a certain level of virility, not just for living long, but also making sure that you're living long and still being able to reproduce. If you're alive, then your job is to be able to reproduce, add on to the genetic material. We already know what the majority of these points are good for. Bladder 23, kidney back sheath, dew 4, good is also good for tonifying the Ming Men fire, which is also a big thing because this is the seed of our primordial essence, all right? So if the Ming Men fire is declined, then that also means that the libido, and we'll also be experiencing more cold symptoms within the extremities, in which case we understand, or we already know that formula, which I didn't put on here, but Sini-san would be one of the best formulas for treating erectile dysfunction, although it does not have that indication. A second pattern I identified in correlation to erectile dysfunction was blood stasis in the lower burner, in which case the obstruction of qi leads to obstructed blood flow in the lower abdomen. Where qi goes, blood flows, all right? So if there's no qi going to the lower burner, then that also means that there's going to be no blood that's going that way either. For this treatment, we remove the stasis, nourish the blood. The tongue is usually pale purplish, puffy, purple representing the stasis or the stagnation, weak, wiry, also showing stagnation, and maybe deep. Once again, some similar points up to ren 4, bladder 23, dew 4, ren 4, all do the same thing, tonify the kidney energy. But we also add liver 3, Li4, spleen 10, and spleen 6. Liver 3 to move chi and blood, Li4 to open up the extremities or the muscles, so that way the blood can go ahead and flow along with the chi. Spleen 10, because this is also a blood stasis, we have to move the blood. If the blood is not moving into the lower burner, then there's not going to be any erection happening. Spleen 6, which is also good for regulation of water metabolisms. And I identified one formula which is normally used for female reproductive related issues or blood stasis in the lower burner. But I felt like this formula would also be very good for treating it because blood stasis is blood stasis. So, and basically this formula was more so for cold in the uterus, which is also associated with the Chong Mai, which is the sea of blood meridian, but with the Chong Mai houses the Ren Mai. So if we have the sea of blood not nourishing the sea of energy, which would be the Ren Mai, then that shows our blood stagnation. We need to move that. Some other things to consider is that erectile dysfunction is also, once again, touching excessive sexual activity. And I put up here singles and doubles. Singles because more times than not, you can find a man entertaining himself. And that's not always the best thing. Once again, TCM teaches us the conservation of our seed. It takes 72 hours for spermatogenesis to occur, which means that anything that a man consumes, drinks, looks at, all goes to the production of his sperm, and as well as the quality of his sperm. And keeping this in mind, whatever that digestion is also a mental concept, all right? Which whatever it is that we expose ourselves to is what we digest, all right? That's not just food, that's not just drink, that's also the way that we entertain ourselves. The presence of ED can also indicate the presence of other serious conditions, such as benign prostatic cancer, which is a condition that typically follows or is commonly associated with erectile dysfunction, in which case what we saw for the symptoms of kidney yang deficiency, we also know some of the symptoms that are associated with benign prostatic cancer, mostly the cold sensation in the lower back, weak legs, because the prostate is pushing backwards against the anal canal, in which case the nerves are being impeded, and which is also decreasing the amount of blood flow coming out of the I forget the name of the artery that's traveling, the main artery that's right behind the prostate. But we see that benign prostatic cancer is also very strongly, or very much like what we associate in TCM as kidney yang deficiency. Erectile dysfunction, for prevention, it can go without saying that some of the things we expose our minds and bodies to, such as clothing, skin, applied lubricants, food choices, and our choices to how we entertain ourselves, plays a major role in how and what we will reproduce. Meaning that, once again, what a man consumes, drinks, thinks, will also affect the quality of the children that he produces. All right. I had a friend of a friend mention, allow me an opportunity to use his post, in which case he identifies one of the things that I also associate with the rise of erectile dysfunction, which is pornography. If you look at the medical history between, well, not the medical history, but the statistics between pornography and pharmaceuticals in this country, they're almost running neck and neck. Either they're too sick to have sex, or they're having too much sex to go and get treated. All right. So this is something that that really needs to be addressed. In which case, he identifies that the real problem with pornography isn't that it shows us too much sex, but that it doesn't show us enough. It can't possibly give us an experience of real intimacy. Porn treats sex one-dimensionally, packages it as pixels, and rips it from its original content, relational context. It only titillates with images of sex, but cannot offer the experience of closeness with another person. That's what God is trying to get the world to comprehend. God makes sense. And that was by Speech Thomas from Arrested Development, Tennessee. You know the song. Tennessee. In any case, I think that it's very important to identify or to understand from, not just from, as medical practitioners, that what goes on within a society at large will affect the health of the individual, because the society is made up of individuals who, you know,